I'm Dr. James Wheeler. I'm a radiation oncologist at the Goshen Center for Cancer Care. I was working on a PhD at Notre Dame in the Division of Physical Chemistry, and we realized that cancer cell membranes were very different than normal cell membranes. They had much more water in them, and that got me interested in medicine. So I went back to Kansas to go to medical school, finished my medical school and my internship there, then went to the University of Texas MD Anderson Cancer Center to do my cancer specialty training, and then eventually came here because I wanted to work at a cancer center that did more than just the traditional surgery and radiation and chemotherapy. The integrative care team here was very attractive to me because I wanted to have people that could help with vitamins and other forms of nutritional supplements to help them stay healthy during their course of radiation treatments. I wanted them to have dietitians who would do more than just calorie counts and tell them to drink this many cans of Ensure a day. And I wanted to have people who could work with them with stress relaxation techniques and guided imaging, and to do those kind of things that will help them sleep at night. And I wanted to work at a place that could have a more holistic approach to a patient, and that's what Goshen Center for Cancer Care is. I treat patients with any cancer, and in all different stages of cancer. At this time, I'm mostly treating patients with prostate and breast cancer because those are the two most common cancers in men and women respectively, but any of the adult cancers I treat. I've always been interested in cutting down side effects from all of my cancer treatments, and I've been fortunate to be involved in a number of research projects to cut down on side effects of head and neck cancer and breast cancer side effects and others. But I also have a special interest in palliative care, where people have a limited lifetime, where symptom improvement is so important. That's where I really see that the art of medicine has its greatest benefit. You can save your patients a lot of money if you send them to the cancer center right away, because that way the tests that they get can be tailored specifically to their needs. Not everybody needs a PET scan or an MRI or a whole bunch of advanced images or a lot of blood tests and things. And so as soon as a patient has a cancer diagnosis or they have something that you suspect is cancer, that's the time to send them to the cancer center. They can get the biopsies, we can direct the workup, the evaluations, all the testing, so that we don't waste their time and money. Radiation oncology is its own specialty that's a totally unique world unto itself. At Goshen, we have an ethos unit that allows us to do adaptive treatments, and we're one of the few centers in the country that can do that. The last count I heard, there were 10 centers in the United States that had the equipment. 3 of them were actively doing adaptive radiation therapy, so we're one of 3 centers in the United States that can do the kind of very specific targeted radiation treatments. And we're part of their consortium group, which is an international group of experts that meets monthly to work on new ways of developing this technology so that we can use it better and roll it out to the rest of the country and the rest of the world. The real goal of cancer care is to cut down the side effects while getting the cure rates, and that takes very precise work, and we have the team that can do that.